All right. My name is Cheryl Weaver. I'm the Conference Benefits Officer for both Northern Illinois and Wisconsin Annual Conferences. I'm sure that I have either met you or talked to you or seen your name if you're on this call. I'm happy to welcome Todd Creviston, one of the benefit educators from WestPath. He's going to walk us through Healthflex for 2026. What I'll have you do is save your questions till the end, and then I'll turn off the recording, and then we can do questions and answers at that time. So we'll let Todd go through the presentation, and then we will open it up for a time of questions and answers. So thank you, Todd, for joining us.
You're welcome. Thank you. Hi, everyone. My name is Todd Creviston. I'm a benefit educator at WestPath, and I am happy to present to you some slides around Healthflex. And today is really centered on annual election and those changes that will take place for 2026 Healthflex insurance. Annual election, I'm going to say a bunch of times. It'll be Wednesday, October 29th through November 13th. So you'll have an opportunity beginning today to go into benefits access, look around, use the resources. Another resource that has changed, I think for the better, it's Alex. So Alex is that tool that will crunch the numbers for you to come up with that lowest cost plan. And it also makes suggestions based on what you think your medical spend might be. And it will recommend an HSA account, or it'll recommend a contribution if you're selecting an HSA plan to your HSA each month so that you can cover those expenses and then potentially actually build up a little reserve.
Just bring that to your face.
So here's our agenda for today. And we'll cover Healthflex changes. Alex will talk about the decision support tools. Alex is probably the primary decision support tool, but we do have a couple documents that will help with the with understanding the plans, the plan comparison, and also the how do I choose document. And we'll make sure that everybody gets their hands on those as well. And then we'll also talk about the process to make your elections. Remember, that's a two-step process. I'm going to say that a number of times as well. Ooh, I think we need to have somebody go on mute if we could. There's a little bit of background conversation. Thank you for that. But remember, making your benefit elections is a two-step process. The first step would be to use Alex, because Alex is going to help crunch those numbers for you and show you a plan comparison based on cost and out of pocket. But then the next step, so Alex just kind of recommends a plan. You'll need to then go put those plans into action, and you'll do that by going into benefits access and making those choices in benefits access. And then we'll have plenty of time for questions at the end. To be honest, I wasn't going to include the next two slides because I didn't want to be boring. But in having a conversation with my wife last night and my 22-year-old son about healthcare, I thought it might be good just to add these back anyway. These are terms and acronyms that when you work in this area, you throw out like everybody knows exactly what you're talking about. But these are important definitions and important terms. So let's just review these real quick, and then we'll continue on. So coinsurance, that's the percentage of healthcare expense paid by the individual or the health plan. And until you meet the deductible, there is no coinsurance. You'll pay that full discounted cost until you meet your deductible. The copayment is a flat dollar amount that the individual pays toward a healthcare expense. And that could be, if you're in the B1000, you're going to the doctor, and for a regular visit, you're not feeling well, you'll pay a copay for that. Explanation of benefits, that's the document that you either get in the mail or you get an email about that explains how your insurance processed the claim for the services that you received. Formulary is just the list of prescription drugs that are covered by Healthflex. The deductible, I alluded to a little bit earlier, but that's the amount that the individual pays in full before coinsurance kicks in. So I'm on the HSA 5,000. I cover all the costs up to 5,000, and then coinsurance would kick in, right? An important note in the parentheses with that deductible, if you're in the B1000, your copayment that you pay doesn't count to go see your doctor, doesn't count towards your deductible. So that's an important piece as well. Out-of-pocket max, I think, is the perfect acronym. Me having had a surgery, my son having had a surgery, and some physical therapy to follow, and a couple of other things. In my family, I think we've had an OOP year 3 out of the last 5. I was thankful that I had money in my HSA account to help cover those costs, but the OOP or out-of-pocket max is the maximum the individual would pay for covered medical, pharmacy, and behavioral health services in that given year. Premium credit, that's the amount your plan sponsor gives you toward Healthflex premiums. So that offsets the cost of those premiums each month. The premium, that's the monthly payment, the payment that you make for the privilege of being in that health plan. So a premium could be for your Healthflex. We also call premium other insurance for your life insurance, your automobile insurance, your homeowner's insurance. Some of those are paid monthly, some of those are paid quarterly. And for me, we pay our house insurance annually. Two kinds of plans. The HMO, or the Health Maintenance Organization, that typically is a plan that requires primary care physician. In this case, the only HMO that we have available is the dental plan, the dental HMO, DHMO, but it acts just like a regular HMO. You'll need to have your primary care dentist, and if you have multiple individuals on your plan, they each need to have a dentist assigned. And then you'll need to stay in that network with that dentist, okay? There is no out-of-network coverage for that HMO, that DHMO. Then we have PPO, Preferred Provider Organization. These are a little bit broader in networks, and they typically include in-network benefit and an out-of-network benefit. And that is true for all the Healthflex plans. And now we have the health savings and reimbursement accounts. There's basically 3 of them. The first one that we have listed is the FSA. That's the flexible spending account. Think of spending as in I need to spend it because we're not able to roll over a significant amount of that balance. So if you have a lot left over, you could end up losing it. The up to that rollover amount. And I think this year the rollover amount last year to 2025 is $660. I'm not exactly sure we know the 2025 to 2026 rollover. Typically, all of that comes out when they talk about the contribution limits for increasing 401ks, 403bs, and all that. So that'll come out sometime in October. So we have a healthcare FSA and then a dependent care FSA. And the dependent care FSA is for covering daycare for one of your children up to, I believe, 12 years of age. Then we have the HRA, which is a health reimbursement account that goes with an HRA plan. And then we have an HSA, which that's a health savings account you could think of that rolls over. You can roll over your full balance year to year. So that if you have a OOP year, you have that money set aside to cover those costs, that deductible. So those are the terms and I was going to say terms and conditions, but those are the terms and names that are important to get comfortable with healthcare. There's no changes this year in the Healthflex benefit options. There'll be 6 plans. There's 3 H plans. That means that those come with HSAs, health savings accounts. That's why those at the top have a green leaf. So the H5000 is an HSA plan, and it comes with an HSA account. Make sure that you accept the terms and conditions when if you're choosing that benefit. And then we also have the HRA. Those come with a health reimbursement amount or account. Sometimes it's health reimbursement arrangement. Sometimes you'll see health reimbursement account. They're the same thing. That means that your employer is putting money in that account for you, and then that money is for you to spend on medical coverage. And there is a roll. You can roll over unused from one year to the next as well. The orange leaf indicates that the B1000 doesn't automatically come with a plan or a health account. If you're on the B1000, you can actually elect to open or to use the flexible spending account. That means your money from your paycheck that you designate will go into your account each month, and it's there for you to spend on your medical coverage. Oh, incidentally, the number represents the individual deductible. So the H2000, the individual deductible is 2,000. The family deductible would be 4,000. It's nice to do math. There are 3 dental plans. The passive PPO and the PPO share the same network. And then the dental HMO, we call a narrow network. That's a plan that's driven by zip code. So there might not be a dentist that accepts that plan in every zip code. That's why we say up to 3 dental plans. There are 3 vision plans as well. Exam Core just includes the exam. Then we have full service and then Premier. And I love this visual because it shows you exactly the primary benefit right there in the logo. Full service, you can get 1 pair of glasses or contacts in a given year. And the benefit is $160. For Premier, we have 2 pairs of glasses. That means you can get 2 pairs of glasses, or you can get a pair of glasses and a pair of contacts, or not a pair, but a year's worth of contacts. And then here's our friends, the health and reimbursement accounts down here at the bottom. HSA, green, HRA, blue. And then we have it split out between the health FSA, and the health FSA is for medicines, doctor's visits, those medical related expenses. And then the dependent FSA is a separate account. It's all included on 1 card. You'll only get 1 card, but all the accounts are on 1 card. And that dependent FSA would be for childcare. And there's some wonderful news for those who have who are using that benefit that I will cover in a little bit. So those are the Healthflex benefit options. There are no plan changes related to what we see here on the screen. I always think that's good news. Let's just take a real quick review. This was another conversation last night at the dinner table, and I decided to add this slide back. One, it's also a good reminder for me, so thank you for letting me indulge in my learning. But the deductible, so basically all health plans work the same way. It's just different costs on how we get there in co-insurance. So initially, we all pay the deductible. You could be on the H2000, the H5000, the C3000, or the B1000. We all have to pay that first amount. And then you can use your health account to cover those costs to get to the deductible. And then once you reach the deductible, and then co-insurance kicks in, and that co-insurance is the cost share, and you'll each cover a part of it. The plan will cover part of it. You will cover the other part. And then all the plans have the same out-of-pocket max. $5,000 for an individual, $10,000 for a family. So that's the same for all plans. So you'll continue to pay co-insurance for medicine and those visits and the medical cost up to that out-of-pocket max. Once you reach out-of-pocket max, there's no additional cost or no additional expenses for covered services. And then we like to call out again that co-payments can be due before or after the deductible has been met, but not after the OOP, the out-of-pocket max, is met. Once you reach the out-of-pocket max, you won't pay co-pays either. And then just a reminder, co-payments don't count toward the deductible. Non-covered expenses and dental vision expenses also don't count toward the deductible, the Healthflex medical deductible, okay? Your dental vision could ultimately have their own max as well. So this is the first bit of good news. MD Live is coming back January 1 at no additional cost. You could use it for zero cost. And I hope we have folks that have used it. I was actually traveling. I was in Lancaster, Pennsylvania this June. I wear contacts. These are readers. I woke up in the morning and I had a scratchy eye. And for those folks who've worn contacts, scratchy eye means, you should go see somebody. I was able to call, and I sent a picture of my eye to the doctor, and we reviewed my symptoms, and I was able to get a prescription before I showed up in the morning to present on healthcare. So it was telling. But there's a budget reconciliation legislation that was signed July 4th that included this back in. So that is great news. Permanently, that bill will permanently allow telemedicine to be covered at $0 without meeting the deductible. For my appointment that I had in June, I paid $51.46. Still a bargain because I'm on the HSA or H5000. Still a bargain at $51. That's why I called them, not only for convenience, but also for cost. But next year, it'll be at no cost. So Healthflex will begin zero cost share for MD Live virtual healthcare and behavioral health for all plans. So the H plans, the C plan, the B1000, they all get that benefit. Virtual medical care, that's non-emergency medical care. Fall out of a tree, break your arm, that would be hospital visit. My example of wake up at 7 o'clock in the morning with a scratchy eye, that's perfect for MD Live. And then no cost for behavioral health as well. MD Live also can get you access to psychiatrists for emotional health too. So that is fantastic. There's a couple places to access this information. The first, we don't have shown, but it's on the back of your Healthflex card. So that's what I used. I woke up, scratchy eye, grabbed my wallet, pulled out my Healthflex card, flipped it over, and MD Live phone number is right there. To To set it up or even to gain access to it, we show here that you navigate westpath.org, click on benefits access, and then the next page, you'll see a summary. You can scroll down and click on telemedicine. And that telemedicine will take you to MD Live. If you're not currently set up for it, if you haven't had a conversation with MD Live yet, I would encourage you to set aside a little bit of time and set that up, because then and if you're not set up and you set it up today, but you need the benefit 2 years from now, they're going to know you, and you'll cut to the front of the line quicker because you won't have to go to the registration person. And I misspoke. It's not really cutting in line. It's just that you're going to get care sooner. Okay. If you're not enrolled and you call them, by all means, they will expedite the registration process, but they need to collect your information first, set the account up, and then get you in the queue to talk to a doctor. So if you do that in advance, you don't have to do that other stuff. I actually talked to a doctor in under 15 minutes. And I was on my way to Walgreens before the prescription actually got there. So if you're not enrolled, we encourage you to enroll, because when you're not feeling good, you're going to get to talk to the doctor quicker. And then this I was completely shocked about. So there was a law, whatever was passed, it allows for a higher dependent care FSA limit. It's been $5,000 since 1986. Back in 1986, I'm sure $5,000 covered a number of weeks or months, but it's been $5,000 since then. 40 years later, 2026, without further ado, they're raising that to $7,500. That comes out to $625 a month if you wanted to max that out. That would $625 a month would come out of your paycheck, go into your FSA, come out of your paycheck before tax. So you're going to save some money in taxes, but then you'll have that in your account each month. My youngest is 19, so we no longer qualify. But I'm happy to hear that it's gone up, because childcare is a significant expense. Two primary documents that we use for resources. The one we have shown here, and it's the comparison brochure, plan comparison. It's really easy to look at. It's colorful. Green is always HSA, blue is the HRA, and then the orange is the B1000. So you're able to look quickly, study it, figure out what your benefits are for each of those individual plans, to be able to make a choice based on what fits you best. In benefit education, we like to teach you all the examples, so that you'll select what you understand. Well, actually, no, you'll select what fits you best, not what you understand most. So we'll make sure everybody gets copies of those. Are the monthly net cost by plan and tier. So that's a lot. So monthly net cost. This is
this Northern Illinois, or is this? We might want to skip this since we have both on there.
That's not Northern Illinois.
No.
okay. Oh,
There we go.
Oh.
Vision and dental are the same for both conferences. So let's do those.
perfect. Sorry about that.
That's okay.
So here's the vision plan. I thought I hid those slides. I don't know why they came back. So these are the vision plan premiums. Exam core is at no cost. That's probably the default, right, Cheryl? The default means that if you don't make a choice, that's what you'll get. Even if that's what you want, please make the choice. We like folks to go in, use the different tools, and make those choices. Make an active choice. So Exam Core is covered at $0. What you get with Exam Core is the exam. If it turns out that you need glasses, there is a discount on glasses and contacts. Full service includes either glasses or contacts, and it's up to $160. Up to the benefit of $160. And then Premier Vision includes 2 pairs of glasses or glasses and contacts in the same year. And we can go back to dental. Here's our dental. And it's by tier and by plan. So participant only, participant plus 1, participant plus 2. As you go up the tiers, the cost does as well. And you'll notice the difference between the PPO and the passive PPO, and then the dental HMO. I'll be honest, I'm actually looking at the dental HMO because my youngest thought he needs braces. The dental HMO includes adult orthodontia, where the other 2 plans don't, but it's a bit of a puzzle for me because he's down in Champaign. So where do I pick his primary dentist? Only time will tell. So there's the dental and there's the vision. And then included in all of the plans, we're making a pitch for well-being. That includes the formerly known as Virgin Pulse. It's now Personify Health. There is a wonderful app that you can download to your smartphone that helps with your tracking, but it also gives you access to all the other well-being benefits, including biometric screening, health coaching, diabetes prevention, emotional health, and more. You can earn up to $410 annually by completing all of those different activities associated with the Pulse Cash. So you can earn $160 a year, up to $160 a year, for reaching the level 4 in each of the 4 quarters for the Personify Health activity program. So that's $160. You could earn $100 in Pulse Cash for completing the biometric screening. And then you can earn $150 in Pulse Cash for earning $150 or earning 150 wellness credits. Those wellness credits include coaching, completing the biometric screening, and having results in the ideal range recommended by the American Heart Association. So there's a lot of ways to earn those wellness credits for a total of $410. And then you'll also need to complete the health check. The health check is an online questionnaire. The health check online questionnaire and the biometric screening are actually 2 important pieces that Westpath, that Healthflex staff use to identify areas where there might be a need. And the best example for that are 2. The health code, the first aid for mental health, and the addition of MD Live emotional support. Those 2 were added because of the results that we were seeing from the health check. And then from the biometric screening and the health check, we noticed that medical spend was increasing around diabetes. So we added the diabetes prevention program, probably about 7 or 8 years ago. But since that was added, it's expanded. So it's more of a preventative program now. They've expanded to not just working with people with type 2 diabetes, but also people with type 1 diabetes. And there's a focus still on pre-diabetes, and that would be the diabetes prevention program. So that program has expanded dramatically over the years, and it actually shows it's worth its weight in gold. The call care coordinators, I hope you'll use the call care coordinators. I've used them a couple of times this year. Essentially, on the back of your Healthflex card, there's a number that says call care coordinators. You'll call them instead of calling Blue Cross Blue Shield of Illinois. So the call care coordinators are there. There's a bunch of different people. They wear a couple different hats, including nurses that can help with diagnoses and the process around a particular diagnosis. They're also benefit experts, claim specialists that all help to explain the EOB. Sometimes the EOB, the explanation of benefits, isn't as clear as it could be. The call care coordinators can provide more information around that care. They can help you find in-network providers. They can help you, that could be from a doctor to an MRI facility. They can help with coverage verification and approvals. When I had my shoulder surgery, when my son had his elbow surgery, we worked with them to make sure that it was getting approved prior to the surgery. It's better to know before, right, than after. If it wasn't covered, we weren't going to go have that surgery that day. So they're very important people in that process. And actually, every conversation I've had with them has been delightful. So the call care coordinators, we no longer call Blue Cross Blue Shield. We call the care coordinators. Annual election. So annual election, October 29th through November 13th. So right now you can work through all those different tools, and as early as October 29th, you can go in and select your benefits. Please don't wait until the 13th. I know everybody gets busy. I know things get delayed, but please do your best to complete your elections maybe by the 11th, just in case. You never know what's going to happen with Wi-Fi access and all that good stuff. You can scan this QR code and it'll take you to that link down there. That will take you to the WestPath annual election website. There's a number of videos on here. That's Cheryl. Cheryl has presented to Northern Illinois and Wisconsin a number of times as well. She's got a great video. There's probably another 3 or 4 videos that are really well done that explain a particular concept or area of Healthflex. Actually, that takes us to, okay, my apologies. This will take you to benefit access. This will take you to that Healthflex annual election. This is open to the public. So spouses won't be able to log into benefits access. That's a participant only access. Spouses can go here and get information about the plans and so forth. They won't be able to choose those benefits. For that, you'll need to work together and log into your benefits access account. And then Alex is awesome. Alex now is about 30 minutes to complete. And when Bob Gerlach told me that, I went, oh, where's the extra 10? Because for years we promoted it as 20 minutes. He goes, it's gotten better. It's gotten more precise. So there's a couple more steps in Alex. I think those steps add a lot of value. But essentially, with dad humor, they do change the dad humor out. But with dad humor and dad jokes, it will walk you through that process of entering you, any dependents, medical care, and you won't have to actually, you won't estimate it. It will actually, there's a step in the process now where it will pull in this year's medical spend to the penny. So you'll enter your Healthflex ID number and it'll pull in what you've spent so that it will know what your history looks like and then can apply that to the upcoming year, because that's what we're concerned about when we pick next year's healthcare. So it's a little bit longer, but it's that increase in time is definitely worth it. So the Alex Benefit Counselor is available live, and participants will need to access this through Benefits Access. So you'll log in there, and then at the top of Benefits Access, it'll say something about annual election. Click here to get started. You'll click that button, and then here's what the slides look like. I'm a big privacy guy. So my first question to Bob was, okay, so I'm going to enter my Healthflex ID number, and it's going to pull up my medical spend. Does it remember that? And he said, no. Everything we plug into Alex is forgotten. So Alex has a memory like a goldfish, only about 10 seconds worth of short-term memory. Actually, he'll crunch the numbers and shows it's more than 10 seconds, but nothing is stored. And being comforted by that from Bob, I jumped in and ran through it. You'll actually, this one up here in the right-hand corner is our first step. So I picked male. I entered my age. I wish I was 49. And then if you click that you take prescription drugs, you'll click that like I did. Take Crestor, boom, 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 boom. Type that in and you enter it. So you enter your pharmacy spend, enter your medicine. Talks about, have you gone to the doctor lately? Do you think you're going to go to the doctor in the fall or in next year? You can add those benefits or add those visits. And then I added my spouse, and then I added 3 kids. Pretty easy to do. And then this down here is interesting. This is a new question as well. Alex was getting to this, but they didn't exactly ask it in prior versions. So it says, if you had a medical bill, would you be able to cover it if it were 500? It kind of gives you a range. And right now I've got about 2,200 in my HSA. So I clicked, yeah, I've got about $2,000 to cover a medical bill. So click that. And then I came over here and it asked, do you want to pay more per month for coverage? That would be premium, right? The cost there is the premium. Or do you want to pay less each month for healthcare coverage? That's more of an HSA plan. But with the HSA plan, it's nice to have some spending money in that HSA account. So that's kind of what these 2 steps are getting at. And then the medical spending, that's new. So it'll pull in our current year. And I entered my first name, last name, my date of birth, and then Blue Cross Blue Shield of Illinois. Then I entered my Healthflex number. And after about 15 seconds, it pulled it up. I went, let me see if it's correct. I logged in another way and checked it, and it was to the penny. So it pulls that up. So it's a wonderful. So in this example, the person spent $4,012.83. Happily, mine's a little less than that this year. This has been a good medical spending year. So you walk through those steps, and it'll crunch. It'll still have the same display, and it'll walk you through the deductible, co-insurance, max out of pocket, and it'll also recommend contributing to your HSA account or to an FSA account. So Alex is pretty sharp. You can screenshot this, or actually you can, if you want to take use your phone and scan the phone, use the camera on your phone, it'll pull up that plan comparison. I'm still a little old-fashioned. I like paper. So each year when these come out, I print out the plan comparison in paper. I just like to be able to lay it out and look at it. It's kind of like going on a family vacation as a kid. Who gets the AAA triptych? I always sat in the back with the triptych and the map. So I like the paper. The OptumRx pricing tool is also available right now. And this is helpful especially if you're in an HSA plan, because an HSA plan, you cover the full cost of the medicine until you reach the deductible, unless the medicine's on the preventative drug list, which means that you bypass having to pay. You end up paying coinsurance for it if it's on the preventative drug list. That will help you figure that out. The OptumRx pricing tool will help you figure that out. And then there's also the preventative drug list is off that page as well. Annual election, October 29th through November 13th. Remember that before October 29th, you can go in and use Alex. You can use Alex multiple times. If you enter your email address, you'll be prompted to enter your email address. So it'll actually save that information for you so you can go back and take a look at it. Remember that Alex doesn't enroll you in any plans. Two-step process. Alex helps you crunch the numbers, and then you'll need to go in benefits access and make those active choices for your plan. If you're in an HSA, make sure that you accept the terms and conditions for the HSA so that the account can get set up. If you don't do that piece, then you also won't receive the contribution from the employer if you're in the H2500 or H2000. And if you're like me and going into the DHMO, you'll need to select a primary dentist for each person on the plan. To make those elections, this window will pop up. It won't arrive until October 29th. So once October 29th comes around, you'll see that window on the top. The picture might be different, but that magic button right there, the Get Started, the blue button, is where you'll actually go in and select your benefits. The screenshots to select your benefits are kind of shown here. They're going to look a little different. To be honest, I can't really remember what they looked like last year, except this here is similar, right? So this is kind of the running total of what you're going to purchase. You'll move through, you'll select your medical, pharmacy, and behavioral health come in as one. Those are known as the H2000, H5000, C3000, right? Those are the names. So you'll pick a medical plan, and then you'll pick vision and dental. And these screens just represent those different steps. And if we look close enough, we can actually see that these are Bob Gerlach's numbers, or Bob Gerlach's, the manager of Healthflex. It's actually his account. He took the screenshots. And then this is the select your medical plan. So this is that first step in selecting the plans. This slide probably should have been in the front. And then we see the different medical plan options that you could pick. And these numbers are aren't associated with Northern Illinois or Wisconsin, but the plan names are, just not the amounts. That covers the slide
All right.
deck.
Okay, I'm going to stop the recording.